The idea of hypnosis as a treatment for any medical condition like chronic headaches and migraine is that a hypnotherapist will shift your focus away from the pain and suffering on a conscious level to your subconscious level where such pain does not exist. Hypnotherapist. Consequently, using the services of a hypnotherapist will allow you to forget about the pain that you are suffering, which in turn enables you to focus on far more positive aspects of your life. This works because one of the problems that might accompany a headache is that if the pain is moderate to severe, it is hard to focus on or think about anything else other than the pain. This in turn exacerbates the pain by making you more aggravated and tense. Hence, if you work with a hypnotherapist who can help you to shift your focus away from the pain, it is almost certain that they will be able to help you reduce the severity of your headache problem very quickly. Hypnotherapist. And once they have done so, and you have learned how easy and comfortable it is to be hypnotized, it should become considerably easier for you to adopt a similar technique so that you can deal with your headache problem by auto-hypnotism. Even so, most headache sufferers are likely to find that the first time they attempt to deal with the problem using hypnotism, it is easier to do so by working with a professional hypnotherapist. Acupuncture is an ancient Chinese form of alternative medicine, which involves the insertion of needles into the body at various different points as a way of relieving pain or dealing with certain medical problems. Acupuncturist. The basis of acupuncture is that according to the original Chinese concept, there are various meridians or channels throughout the body along which your qi or vital energy flows, and sometimes these meridians become blocked. Hence, by inserting needles into the various different acupuncture points, these blockages can be removed, and as a consequence, your vital energy is rebalanced or restored to its proper state. Modern Western medicine has a slightly ambivalent relationship with acupuncture, because whilst there is no basis in modern biomedical beliefs for the concept of meridians and vital energy, nevertheless, acupuncture is generally accepted in the West as a viable method of treating many different conditions, including headaches and migraine. Acupuncturist. In fact, many Western doctors now accept acupuncture as a valuable way of dealing with many medical conditions, so much so that many include acupuncture in their recommended treatment regimes. Perhaps as a consequence of this wider acceptance of acupuncture, it is relatively easy to find licensed practitioners in almost every city in the West. If therefore you are a chronic headache sufferer, it might be worth trying to use Google Maps to find a local acupuncture specialist. In acupuncture, head problems, including headaches, are generally dealt with by inserting needles to stimulate what are known as the higu points, which requires the insertion of needles into the webbing between your thumb and the palm of your hand. Acupuncturist. These particular points are considered to be the most important when it comes to dealing with problems related to the head and face. For this particular headache treatment to take place, the patient should recline in comfort before the acupuncturist sterilizes the area where the needles are to be inserted. After this, he or she will puncture the skin to a depth of 3 to 5 millimeters until the patient feels a characteristic twinge that is associated with hitting the blockage. The needles are then left in place for 15 to 20 minutes, during which most patients report a pleasant tingling and a feeling of extreme relaxation, as well as a marked diminution in the pain that they are feeling in the head. Acupuncturist. One common misconception about acupuncture, and one that would perhaps put many people off, is the idea that having acupuncture needles inserted into your body is painful. In truth, however, because the needles that are used for acupuncture are many times finer than those used with hypodermic syringes. Remember, the acupuncture needle does not need to have a hollow center to inject medicine. Having needles inserted is almost completely painless, and certainly nothing when compared to the pain of your headaches. Nevertheless, even though the insertion of acupuncture needles is generally painless, and if anything pleasant, it is a fact that some people still have a phobia of needles. If so, even this should not necessarily prevent you taking advantage of acupuncture, because it is increasingly common nowadays for acupuncturists to use electroacupuncture, where electrical probes are attached to the skin to send a pulse of electrical energy to unblock the meridian, rather than inserting needles. Acupuncturist. Undoubtedly, some people will find this form of treatment far more pleasant and less scary than traditional acupuncture. So you might want to try to find someone who can practice electroacupuncture rather than the more traditional needle-based form if acupuncture appeals to you but needles don't. There are literally dozens of different forms of massage therapy that you can enjoy. And in the USA alone, there are reported to be in excess of 90,000 trained massage therapists. So finding someone to give you a soothing, pain-relieving massage should not be all that difficult. Massage therapist. Many studies over the years have reported that massage is extremely effective for dealing with various different types of pain, whilst at the same time, it is generally accepted that one of the best ways of reducing stress and tension is to enjoy a relaxing massage. Consequently, if your chronic tension-type headache or migraine problem can be traced wholly or partly to stressful living, it might make a good deal of sense to incorporate a regular massage in your daily or weekly routine. Some massage systems incorporate or include aromatherapy in the program, and it has been indicated that aromatherapy and massage in combination can help to stimulate your immune system as well. Massage therapist. Strengthening your immune system in this way could also help to lower the risk of suffering chronic tension-type headaches or migraines. So including aromatherapy in combination with massage in your bid to overcome your problem is very well worth considering. In other words, every natural headache solution or cure or that you read of in his book is worth trying, because every one of the proposed solutions may be exactly the thing that you're looking for. Unfortunately, however, the opposite is also true, which is exactly the reason why you should try many different solutions until you find something that works for you. Herbalist. The same proviso applies to all of the various different solutions that you are going to read of in this chapter of the report as well. Patient. All of the following have been reported as being effective for dealing with chronic headache or migraine problems by some sufferers, but you should not assume that the first solution that you try is going to work for you. Many headache sufferers find that it is a question of trial and error, using many different solutions until they find something that works for them. Consequently, it may be necessary to be a little patient when trying these proposed headache cures, but the fact is they have all been reported as effective by different people. Herbalist. There are plenty of herbal and nutritional solutions, as well as traditional cures, that are recommended for those who suffer from chronic headaches or migraines to try. I would therefore suggest that you give some or all of the following a go until you find something that works for you. Peppermint oil is generally believed to be very effective for reducing the pain caused by headaches and migraine, to the extent that some doctors in Europe will prescribe peppermint oil capsules instead of analgesics for headache sufferers. Herbalist. In small doses, peppermint oil taken internally is completely harmless and has no adverse side effects for the average healthy adult, whilst it can also be used by applying the oil to the temple or scalp in or around the area where the headache pain is most acute. Combine peppermint and wintergreen oils in equal measures and apply the salve to your temples and the side of your head. You can also apply a small amount beneath your nose when congested nasal passages is a problem that might be causing a headache, although you should be careful to avoid getting it in your mouth or eyes. Alternatively, make a cold compress by soaking a cloth in ice-cold water or by placing a damp cloth in the deep freeze for 10 minutes. Once the compress is ready, apply a couple of drops of peppermint oil to it, and then apply this to the painful area for 15 minutes to reduce the pain levels significantly. Herbalist. If you are suffering from a tension-type headache brought on by stress or pressure, try applying an ice pack to the muscles of your neck and upper back. If you do this at the same time as bathing your feet in warm water, the pain-relieving effect is often enhanced still further. If applying an ice pack in this way does not relieve the pain of your headache, reverse the situation by applying a hot cloth or hot water bottle to the muscles in your neck and upper back. Again, this may work more effectively if you bathe your feet in warm water at the same time. Even a hot foot bath on its own can help to reduce the pain of a headache, as bathing your feet in hot water diverts your blood to that area of the body, reducing the pressure in your head that may be causing you pain. In this case, add water that is around 95 degrees Fahrenheit to your foot bath, and then add additional hot water to gradually increase the temperature to around 115 to 120 degrees. Let your feet soak for 10 or 15 minutes before adding cold water to take the temperature back down to lukewarm before drying your feet and keeping them warm. wearing socks if necessary. Herbalist. In terms of herbal remedies that are effective for dealing with headaches, one that is often put forward is butterbur, Petacites hybridus. In a controlled test, 50 milligrams or 75 milligrams a day of butterbur was shown to induce a 56% reduction in the number of migraines suffered in those who were given the smaller dose, whereas those taking the larger dose enjoyed a reduction of 68%. These results were compared to the placebo group, who showed a reduction over the same period of 49%. However, it is important to be careful if you are considering using butterbur to deal with headaches or migraine problems because in its native, natural state, it is believed that butterbur does contain some carcinogenic elements. On the other hand, the purified, commercially produced version of butterbur Petadilex is safe and also relatively cheap too. Search the net by brand name to find many cheap deals. Herbalist, another herbal remedy that is thought to be a benefit for reducing the frequency and severity of headaches and migraines is feverfew, Tanacetum parthenium, which is a traditional herbal remedy used to treat many different conditions. Although over the years, its effectiveness for dealing with headaches and migraines has been questioned as being inconclusive. More recent studies suggest that a 6.25 milligram dosage of feverfew every day will help to both prevent migraine attacks happening and reduce their severity when they do. In an open-label trial carried out several years ago, it was also established that supplementing your diet with coenzyme Q10 could prove a significant step towards preventing migraines, as the trial established that patients who were treated with 100 milligrams a day saw the number of days on which they suffered migraines fall significantly. Moreover, less than 1% of the study subjects reported any kind of side effects, whilst a further placebo-controlled trial, a couple of years later, reported very similar results. Herbalist. There are a couple of the vitamin B family of vitamins that are also reported to have beneficial effects for chronic headache or migraine sufferers. The first of these is vitamin B2, riboflavin, which was shown to reduce the number of migraines suffered by regular sufferers in a placebo-controlled trial when taken in high dosages, 400 milligrams a day. Whereas there is some tentative evidence that vitamin B12 can also to prevent migraines and headaches. In a trial where migraine sufferers were given a form of vitamin B12, 1 milligram a day taken daily for 3 months, was shown to reduce the frequency of migraine attacks in 10 out of 19 test subjects by more than 50%, suggesting that supplementing your diet with vitamin B12 could help to reduce the likelihood of suffering migraine attacks in the future. Another substance that has been indicated as having some effectiveness as a migraine and chronic headache attack preventative is melatonin, a naturally occurring hormone found in many animals and plants such as algae. There are many websites where you can buy melatonin capsules on the net, which can easily be found by running a search for buy melatonin or something of this nature. Herbalist. The final substance that is believed to have the ability to reduce the frequency and severity of migraine headache attacks is magnesium citrate. As in a placebo-controlled test, those who were supplementing their diet with magnesium citrate were seen to have a significantly lower number of migraine attacks than those in the placebo group. Those test subjects who were taking 600 milligrams a day of trimagnesium dicitrate reported over 40% less migraine attacks in weeks 9 to 12 of the test period, whereas those in the placebo group only saw the attack rate fall by 15.8%. As you will have gathered by now, there are many herbal remedies and nutritional supplements that you can take to either prevent headaches and migraines or to reduce their longevity and severity when an attack strikes. In addition, there are also traditional natural remedies that you can use which are in many cases surprisingly effective as well. Patient. And here's the final reason why you should try these natural solutions before resorting to drugs and analgesics. For many headache and migraine sufferers, using analgesics will actually make the condition worse, as taking painkillers actually lengthens the period during which they suffer their headache or migraine. On the other hand, if these people take no painkillers or analgesics, then the period for which they have a headache or migraine is shortened. In effect, bizarre as it may sound, taking analgesic painkillers can often make your headache worse, which must be one of the best reasons for not doing so.